Good afternoon, ladies and gentlemen. My name is Sheila Seal. I will be doing my speech today on the importance of basic wound care. The United States population of more than 270 million people, with over 2.5 million deaths occurring annually from wounds being neglected, results in the infection, eventually leading to sepsis, then death. Understanding these statistics, are you ready to give your life for this illness from neglect of a little scrape or a little scratch? This devastating illness has no age limit. It has no bearing on gender, race, or even culture, but rather attacks everyone at all ages. The economic effects of this illness can be felt in all manners, as a new wound costs little to nothing, a few dollars to take care of, while hospitalization could cost over hundreds of thousands of dollars. But also funeral expenses, whereby the illness that it caused could cause death. Basically, ladies and gentlemen, please take care of your wounds, because end result could possibly mean death. The Center for Disease Control and the National Vital Statistic Reports provide several provisional notices and preliminary reports in regards to how to properly care for wounds in general, to these with complications. The CDC states mortality rates in infants under 1 year of age is 1 in 141. 1 to 44 years of age would be 1 in 75. 45 to 84, 1 in 97. And 85 plus, 1 in 6. Stating that our elderly sometimes get wounds and basically do not report them, and our family members are too involved that they do not realize that this patient has a wound that possibly could cost them their life. Although statistics states that the elderly and I'd say the first few years of life, 1 to 3, is the higher statistics of infection. Basically, we all need, as parents, need to check our children out, make sure they don't have any wounds that we're not knowing of. Also, check your father and mother. Just make sure that they don't have any wounds that you're not aware of. This is very important to controlling and keeping from getting bad infections that could cause you to end up in the hospital and have really, possibly cost you your life and really have significant problems. How do we do these things? How do we identify, treatment? How do we identify that we have a wound that needs to be treated? We assess the wound. What type of wound do we have? Do we have a puncture wound? Do we have a scrape? Do we have a laceration? What type of wound do we have? And also, you need to basically, if you find a wound or you have a wound, you need to do specific things. You need to clean that wound out, irrigate it with water, find out if there's any specific substance that are in there, like glass or metals, any type of metals that could cause you to get an infection. Metals that could go underneath the skin and cause specific wound infections. Where did it occur? Did it occur, basically, what type of atmosphere was you in when it occurred? This kind of tells you how you need to treat your wound. What is the need to provide basic wound care? What is the essential materials that is needed? I do have some essential materials that I'm going to show you, basically, and Miss Abigail right here that I'm holding, and you're probably wondering why she's been here, but she is going to help me do my demonstration today. Say hi to Abigail. She basically has a wound on her head. Mom, taking her out of the crib, basically hit her head on the crib as she was taking her out. Not being neglectful, just basically was an accident. So we have to take care of Miss Abigail's wounds properly. First, we want to use soap and your basic sterile water. We're going to take that and we're going to take Miss Abigail and we're going to clean that wound really, really well to make sure we get all of the specific things that could cause her infections out. This is something we need to do prior to dressing this wound. Then we're going to get, gloves. If you have gloves, use those gloves prior to doing a specific wound. This wound is just a little scrape, so we're not going to worry about that because basically it's not a laceration or it's not a deep cut. You also want to put a nice Telfa pad over it. A Telfa pad to actually keep that wound from sticking. But before you put the Telfa, you're going to want to actually take and put antibiotic ointment. We're going to place that antibiotic ointment right there. With my Telfa, we're going to actually place that on her head just like that. As we do that, we're going to take and we're going to wrap this little scrape up just like this for Miss Abigail. Miss Abigail's going to feel so much better because it's not going to hurt as bad. She's going to feel much better. Now, as we do this, we're going to use some non-adhesive tape. It's called paper tape. All of these specific products can be bought in your regular store. Any of your store will possibly have it, and this is called just a gauze wrap. Now we have Miss Abigail all fixed up to where her wound is clean and she will not get a specific infection. But not only that, we need to clean this wound twice a day and make sure that we see no signs and symptoms of infection, which is redness, swelling, pussy drainage of yellow, green, dark color, increasing size of that wound. We don't want it to increase in size. Or if it's tender to Abigail, or if Abigail starts running any type of a fever, we're going to make sure that we contact her doctor. What type of follow-up treatments do we need? We need to make sure that Miss Abigail gets a good dressing change twice a day, as we were stating. We also need to keep that triple antibiotic on there. And we also need to make sure that we're promoting healing this wound. Basically, we're going to also, if we see this wound get infected, we need to contact her doctor. Knowing that tetanus shots, if this baby has not had a tetanus shot within 5 years, we need to make sure we contact her doctor, so we could get her a tetanus shot. Basically, to keep her healthy and not gain any kind of tetanus in that wound. Not only that, there's other specific things that can cause wound infections, which is basic puncture wounds any wound can get what is called a methicillin-resistant staph, which is a staph infection, which is a nasty wound that could cause this specific type of sepsis that could enter the blood and cost you your life. There's also many other different types of specific infections that you can get, as far as Pseudomonas. Also, there is a infection that causes the flesh to actually basically it's a flesh-eating bacteria. You never want to get this specific wound. So please try to keep your wounds clean. We're going to go over the specific things that needs to be done. Basically, we need to make sure our wound is first cleaned, assess your wound, do proper wound care, and do your follow-up treatments. Make sure you basically change it twice a day, assess for any signs and symptoms of infection. And if you do see signs and symptoms of infection, contact your physician and make an appointment to go in and see him and take care of this wound before it costs any higher cost to you for his hospitalization. I hope you enjoyed my speech today, and also say goodbye to Miss Abigail. She was a very good patient. Thank you and have a nice day.